Hello, everyone. I wanted to share my journey on getting this new procedure for the ACL, the BEAR implant. Had a climbing injury. I fell while bouldering about like 8-10 feet up. This was August 14th. It was indoor climbing. I had landed on my right foot and twisted my upper body with full impact and full quad activation, which is the incorrect way of falling. Um, and then I immediately felt pain, severe pain that took me to the floor. It took my breath away. Didn't really hear a pop, but it was also loud, so I'm not sure, but I could not bear weight on it. So I knew something was wrong. To urgent care the following day, and then they did the test, the Lockmans, and they were like, yep, your ACL's torn. Get an MRI. Got the MRI that weekend. The MRI came back and it was read as a mid-substance tear, so a tear right down in the middle of the ACL. And it said subacute, so I guess it means somewhere between chronic and acute. And I think I had injured my knee like years before, but I never got it checked out, so I'm not sure. I definitely felt extremely unstable on my right leg walking around. I could feel that buckling occasionally, so that was something new that I had not felt before. So I talked to several orthopedic surgeons, and I talked to 3 in my area. Literally saw 3, and that bill racked up to $500, but they all recommended the same thing. Granted, the first one recommended the patellar tendon, and then the second one recommended the quad tendon, which is much better. But I am so happy that I decided to do some more research on it. Well, 2 of them were really highly esteemed orthopedic surgeons in my area, and they just didn't even bring up repair. It was like any reconstruction, tendon reconstruction was the only method of doing it. And I mean, now it makes sense to me after doing all this research. Doctors are going to recommend what they do and what they know best. So it works great for people, and there's like 200,000 whatever amounts of people tearing their ACL per year, and 100,000 of those getting reconstruction. So it's, the gold standard, and right now it's the standard method. So nothing against that, but it was not for me. So I actually came across the BEAR on when I was scrolling on Instagram. So thank God for social media. It popped up on my explore page when I was looking up things about like ACL rehab, just getting myself prepared for that. And I read more about it, and I was just so fascinated by the fact that they could preserve your native ACL, and the fact that the native ACL has so much that, a random piece of tendon in your body to make a new tendon does not have, like proprioceptive cells and even nerve endings. And proprioception is just to help with knowing where you are in space, and that's something that's that's usually has to be trained after ACL reconstruction. I intrigued. The website was super interesting. Watching the videos of how the collagen sponge work, and so, my thought process was like, just why not? Why not do something that's going to preserve something I already have, that I already know works, and can have a potential to be fixed. So I searched for a surgeon who could do it, and the first surgeon I talked to in my local area told me that he knew how to do it, but he didn't recommend it for me. And he kind of pushed to do the quad or do some kind of reconstruction on me, because he was just like, yeah, this is still very new and studies aren't out yet, so it's not really been proven, so I would still recommend the reconstruction for you. And I was like, this dude is not it. So I ended up finding a doctor about 2 hours away, a surgeon who, because I wanted someone who was gonna be interested in this new procedure and believe in it. But it's important that your surgeon believes in what they're doing, and that it's important that your surgeon aligns with your values. So the surgeon that I found had already done like 6 or 7 of these, and he was like walking me through it, and he didn't make me feel like like I was stupid for not doing a reconstruction, or that like it was a bad choice not to, like the other doctor did. He didn't even, at the end of it, he wasn't like, while we have you in there and you're asleep, we're gonna do a reconstruction if we can't find enough of your ACL left, because up until that point, based on my MRI, how much of the ligament you have left on your bone. So they have to actually arthroscopically look into it with cameras to determine whether or not you are a BEAR candidate. I mean, along with the other things on their website. Like, you have to be within 50 days to be FDA approved, but there are people who do it after 50 days. If you have good viable tissue in there, sometimes it like scars to your other ligament, the PCL, then, you know, there's a higher chance of it surviving and doing well. So it's really a case-by-case basis. Obviously, the sooner you get it done, the better. It's kind of the notion, because, you know, the fresher the injury, the fresher the nerve cells and stuff, which is not true for reconstruction. Studies have shown that the earlier you get a reconstruction, the worse off you are. So it's better to wait with reconstruction, and it's actually better to just do rehab. So that's something to try. It doesn't matter when you get it, within like 1 year or 2 years of reconstruction. And I'm not an orthopedic surgeon, so don't come for me. But I mean, if this BEAR hadn't worked out, I was not going to rush into a reconstruction. I was going to probably do physical therapy for about 3 or 6 months and then get a follow-up MRI, because there are cases of people's ACL healing with just physical therapy. And obviously, it's not for everyone, because some people's ACL completely ruptures and there's like crap all over their place, and they're going to need a reconstruction, and that's just how it is. But there's also like maybe 60% of other people whose ACL like maybe tears differently or tears in a favorable position. So it's very unique to how your accident happened, what your anatomy is, and there's still ultimately so much that people still don't know about the ACL. Anyway, so my surgeon that I had met, he didn't push me that if he was like, if we can't find tissue in there, he was like, we're going to close you up and send you on your way. And I was like, that's what I want to hear. Like, but after some further thinking, I told him that, okay, if there's no tissue left, I'll go ahead and go through with the reconstruction, because the way I saw it was like, if there is nothing there holding my femur and tibia together, and there's probably no way it's gonna heal on its own. If it's a distal tear, because if it's a proximal tear, which means it tears from the top, then you have gravity working with you, so it's like much more favorable. But if it's further down towards your tibia, the chances of that healing are extremely low as of now. You know, things may change 10 years from now, but it, from what I read, is not favorable. And yeah, so after doing that research, I was like, I would trust him to do a reconstruction. Or I wanted to get the BEAR, or I wanted to wait 6 months and do rehab and then get a repeat MRI. And if that MRI still showed that my ACL was torn, get the reconstruction, because I wanted that stability with my ACL to reduce chances of osteoarthritis in the future. And even with the reconstruction, it's still like quite a high amount of arthritis, which is a little worrisome. But I mean, it's the nature of the beast. I mean, you can look at the statistics and feel bad, or you can just do your best and make sure you're taking care of yourself, nutrition-wise, sleep-wise, stress level-wise, PT-wise, and all that stuff. So, yeah, so that's something that isn't taken into consideration for all these folks that were in the study that are included. They didn't put in, obviously, all of their lifestyle factors, which I'm sure contribute to getting arthritis. So that's just something to keep in mind with the statistics. But BEAR, so far in the animal studies, has shown to not cause arthritis, because it's the whole concept of it is for your own ACL to heal. And when your own ACL heals, it means that they don't have to put in these new footprints. So when you get a reconstruction, they have to dig in new tunnels. And the surgeon does their best with appropriating, but there's only so much that, you know, we can do humanly. There is nothing that's so high tech that can determine exactly where your native ACL tunnels are or wherever the attachments are. So they just ballpark it, and then that's probably what's causing the OA down the line, because of that constant incorrect rubbing, not anatomically like meant to be. So that ends up wearing and tearing and causing osteoarthritis online. But with BEAR, you avoid all of that. So that's the hope from the animal studies. They only have 2-year studies so far. So the 2-year studies show that it is equivalent in terms of rehab and return to sports as getting a hamstring graft, and that the hamstring muscle is stronger with BEAR, which is kind of a no-brainer to me. I'm like, if you're taking a chunk of your tendon out from your hamstring, there's only so much of it that's going to heal. But I know there are people who do really well with that surgery. So, like I said, it's just a basic case-by-case basis. I know I got my surgery on September 22nd, so about a month and some change. It was like 38 days out from my initial injury. And I was so lucky that the surgeon was able to like fit me in his schedule literally like a week or two after I met him. And so come to find out, and they told me, before my surgery, they were like, there's a chance you could have reconstruction. And there's a chance you could have BEAR. And when I woke up and I literally saw the teddy bear next to me, I was so happy. And I tolerated the anesthesia really well. I was very sleepy after surgery. I didn't really feel anything. The whole surgical process was like, that was my first surgery, first time being under and asleep ever. So, it was nerve-wracking leading up to it, but, the whole experience was actually very positive, and the nurses were all amazing. And then I went home almost like immediately after that. And then in terms of the first couple of days, you get partial weight bearing. So, about like 50% of your weight can be on that operated leg. And they gave me this folder with everything to take home after my surgery, and then this packet from MIAC, which is their rehab protocol. So I'm gonna put that up on the screen. But pretty much there's information on here that right after surgery you're supposed to be in that T-ROM brace that they put on the T-scope brace, and that's supposed to be locked in extension, which is like 0 degrees, so you're like super straight on the first at least the first 4 to 6 weeks, I believe it was locked. And so I really didn't do much for the first week after surgery. I also had an amazing anesthesiologist who just knocked my nerves out for like a week. I think I was numb for a week. So I read that a lot of people had a lot of pain after 48 hours, but I had this long-acting nerve block, which I'll put on the screen here, that worked for 96 hours, and I had to wear a bracelet because in case I got in a car accident or something, like there was like certain things they couldn't give me while I was on that medicine. It was still in my body. I feel like I guess especially as a practitioner, to feel like the patient, and it was kind of surreal and humbling, and there was definitely many a days when I grieved for my leg, and I just could not stop crying about the fact that my leg was different now. And you lose muscle very quickly, almost within like the first week, because you're locked in that brace and you can't do much with it. And therapy consisted of like ankle pumps, so during that time you can move your ankle back and forth to prevent clots. And then there's something called a quad set, which is where you just have your leg on the table and you're just squeezing your quad trying to wake it up. And so I mostly did that for like maybe 4 weeks. I did some heel raises too whenever I was able to stand up and move around with my crutches more. And crutches take a lot on your wrist and your upper body. So in a good way, I was using my upper body a lot. And I still went to the gym.
Awesome ass pull up. Look at that beautiful forearm. She doesn't know I'm giving her a pipe right now.
Let's see. And I had ice.
She's getting it. She's getting it.
I know some people bought those like fancy ice machines that they have at physical therapy, but I just bought like a $20 pack on Amazon, and it's great. I enjoy it a lot. I had to sleep with the brace on. That was probably the hardest part, was having to keep my leg straight with a bulky brace for like 6 weeks. It was definitely 6 weeks. I may have cut it at like 5 because I started to trust myself with the leg. But I mean, do what your PT and your surgeon say. I definitely like was very cautious with it, but I just wanted to be more comfortable, and I still knocked out and slept really well. I took 2 months off of work. A mental health break for me too, for anybody who's gone through residency and med school, and everything is traumatic. And I just hadn't had time yet to think about all that. Whenever I first twisted my leg and felt the pain and realized I couldn't walk, I wasn't entirely upset, to be honest. And I know that, like, that sounds crazy because it's literally my leg and I've busted my ligament, but I probably can take some time off work. And I don't know why that was like a wave of relief over me while I'm over here with my, like, on the ground because I can't bear weight. To get before surgery. Like, I literally had an Amazon wish list, and if you want to make like a GoFundMe page or something, or there's like a wish list thing that you can do for your family and loved ones, send you. I think it's much better than them just sending like random. I mean, if people are sending you money, that's great because then you can buy your own stuff, right? But I think it's much better than them sending like snacks. Like, you do not need to be eating any packaged snacks like Oreos, candy, whatever the F. Like, no, get rid of that. You don't need that. You do not need that while your ACL's torn and you're like laying in bed and shit. Like, you need to be focused on eating super healthy with nutrition, all that. And that's a whole nother segment we'll get into. But I wanted to talk about a little bit more about the rehab during my first month. So, and then there was also some flexion too. So the first 2 weeks, I think I was able to flex to 30 degrees. And then after that, from weeks 2 to 4, I could flex to 60. And the T-brace shows you how to flex. Or you can adjust it on the T-brace so you know how much degrees you're going. There's this thing called patellar mobilization that my PT showed me how to do too. For the first week, I had to get like a plastic bag, wrapped it up in there, in my brace, and some duct tape around it, and then walk in the shower like that. And we have a walk-in shower, like not a tub, so I could just walk in. But I would definitely recommend getting a shower chair. I never had one, so it was a struggle trying to, like, I would just have someone in there with me so I could hold on to them. But a shower chair would have been really cool. Just having something to sit on would have definitely been very helpful. The other thing that would have been helpful too is like having a stool that's about like up to your knee height, so that you have a place to like lay your leg when you use the bathroom, you know, when you're sitting, to prop your leg up on that stool. I just found myself like using my crutch, like the hole in my crutch. I would prop my leg up in that, or I would just have to hold on to my leg, and it's so uncomfortable. But it was like I just couldn't bend it yet. So I did that, I think, for like maybe a week, maybe 6 weeks. I got so used to propping my leg up because I just wasn't used to bending it. Even now, I'm like favoring my left leg. I'm putting all my weight on my left leg. It's crazy how much you start to depend on your other leg. Cause I'm right-legged, or my right leg's my dominant leg, but it got wrecked. So, my left leg just has to learn how to do stuff. But now it's like I'm just depending on my left leg all the time. So it's a retraining process. Gotta retrain your brain. Be like, this is okay. Feels scary. It's gonna be okay. And then I think that was pretty much it for the first month. Definitely I was really lucky that my significant other was able to stay with me the entire time. He does his own business, so he can choose his hours. So he was able to help me cook, make meals for me, help me up and down the stairs. We have stairs in our tiny house, but I found a way to just like scoot my butt on down. So I did that. Or I do that too. I think this process would be extremely difficult to do on your own. So if you can get, you know, your parents or a really good friend or somebody who's available to be with you, at least during the first month of BEAR, because with reconstruction it's a lot faster. I think with that, like, you're off of crutches in like 2 weeks or something crazy like that. I mean, I was on crutches for 7 weeks. I still use my crutch, actually, my one crutch sometimes when I want to walk fast, because I walk really slow right now. So if I need to walk somewhere faster, like in the grocery store or something, I bring a crutch with me still, and I am 10 weeks out. So it is a really, really freaking slow process, and I think it was okay for me because I had my significant other, and when we went grocery shopping, I just used like one of those electric carts. Or I would just walk really slow with my crutches. But he just did a lot of the heavy lifting. If you need to too, there's a home physical therapy service on the App Store. I think it's called Luna. That if you really can't drive or go anywhere, because I couldn't drive. I didn't drive till like 2 weeks before I went back to work. I went back to work starting December 1st, so I didn't drive till the end of November, and that was like 7 weeks out from my surgery. Just mostly because I was scared, and because I had someone who could drive for me. So, but then whenever I started driving again, it was really easy. So, biggest thing is to not rush into things. It's really easy in the beginning to want to do more than you can, and really just sticking with the protocol. And we'll talk about it later when we get to weeks like where I am close to 4 to 7, and then 7 to 12 where I'm at right now. It's very vague and there's very conflicting information in some of the protocol. You just have to like really trust your PT, because I was like making sure that everything I was doing was safe for my knee and my ACL, because sometimes it just feels like your knee's hurting. It's really challenging because you've babied, at least I babied my knee for so long that it was so atrophied and so small that I didn't want to mess with it. I didn't want to hurt it. I didn't want anything to happen, and I protected it. And it definitely is a mental challenge that I couldn't even step up like 4 inches above the ground with my right leg, and getting through that mentality block and being like, this is safe, like you're safe, this is okay, your ACL is going to be okay. Because you can't see it either, so you're kind of just like, I hope my ACL reattached. I meant to talk about that too. So when he went in there with the scope, it turned out I did have a proximal tear. So my MRI did not match up with what actually was in my knee, which was a proximal tear. But the MRI is hard to read anyways, and it was like shortly after my injury, so there might have been a lot of inflammation. But that was like very important information that I wish I definitely knew earlier, because then I could have gotten something called an internal brace. So that's a side story, but if you injured your ACL and you have a diagnosed proximal tear within 20 days of your injury, an internal brace, because that's primary repair, which is like I feel like it's what's the proven thing for or it's got more research than BEAR does, and proximal tears heal really well. Proximal tears are able to heal on their own too. If that's something, if I wish I could go back in time and knew about, I would have gotten, because that recovery process is fast and efficient, and people are back to playing sports within 5 months.